Hello, everyone, and welcome back to the Roadmap to Becoming a Doctor. In this section, we are talking about medical school from preclinical to the clinical years, an overview of what medical school usually looks like in the United States. And keep in mind that this is usually a 4-year journey. Some people take a little bit longer if they take gap years in medical school, but usually it is 4 years long. Now, medical school is really the time to master the fundamentals of medicine, especially in the first 2 years, which are known as the preclinical years. This is where you focus on foundational sciences like anatomy, biochemistry, physiology, immunology, pharmacology, really understanding the foundations of medicine. And this is a time when you want to continue building effective study strategies and time management skills, because oftentimes people say that the information in medical school is like drinking water out of a fire hydrant, because it just comes out super explosive and there's just so much information to absorb. From there, we move on to the clinical years, which are the last 2 years of medical school. This is when students participate actively in different rotations in the hospital to gain hands-on experience and patient care skills. So this is the opportunity to explore all of the different specialties and to identify what you might be interested in. So you will have to go through OB-GYN, you will have to go through surgery, through family medicine, neurology, psychiatry, emergency medicine, all of the main things that you will need to have exposure to, and then eventually identify what are those areas of interest that you might want to consider specializing in during residency. Now, medical school, we also have two major exams. We have to prepare for the USMLE Step 1 and Step 2 exams. And again, it's great to have the MCAT under your belt, because if you know how to prepare and create a structured study plan for the MCAT, it will only set you up for success for Step 1 and Step 2. You should be utilizing question banks, knowing exactly what content to review, and utilizing tons and tons and tons of practice exams. Now let's talk about what else happens during medical school, and that is your ability to seek mentorship and guidance. Let's say you go through your rotations and you realize, hey, I want to go into general surgery. You really want to start working towards finding the appropriate mentors that are within your field of interest, because they are invaluable in terms of providing advice and support as to how you can become a really good applicant for residency and how you can in general become a really good general surgeon if that's what you want to do. And you can attend career and specialty specific events for networking. There's lots of specialty specific conferences. And with that, if you start engaging in research and scholarly activities, you can conduct research projects in your area of interest to deepen your knowledge, to strengthen your CV and your resume. And if you present or publish your findings, then this is an opportunity for other people to see your work and to be able to connect with them. And that really helps you for future residency applications, because if people have seen your name before, then that really helps. Now, medicine is also known, obviously, for professionalism and developing your clinical skills. You really want to focus on, yes, learning medicine, but also knowing how to have interpersonal skills. How do we appropriately communicate with patients? How do we work in a team with all of our colleagues? And how can we be empathetic both towards our patients, but also with those that we work with? We want to learn to practice evidence-based medicine and patient-centered care. And lastly, how do we take care of ourselves? How do we balance both our academics and being in medicine with our wellness? Because if you are not well, then how are you going to be expected to take good care of other people and patients? You want to make sure that in medical school, you're prioritizing your mental and physical health with regular self-care practices and really building a support network with peers, with faculty, with family, with friends that will be there to support you when you are having a tough time, because medical school is hard. Now, as you reach the later years of medical school, you will have to start exploring residency options, which is the next phase in medical training, and you will have to once again prepare for applications. If you have a chosen specialty at this point, you may want to start researching programs that align with your future goals of becoming a physician. You will have to once again prepare your resume, your CV, a personal statement, letters of recommendation, everything that you have already been expected to do in order to apply for medical school. And you will have to prepare for the residency match process. You will have to apply to programs, attend interviews, and create a rank list in which you rank your favorite programs from most favorite to least favorite. And overall, this is moving on to your next phase in your career of medicine. You want to reflect on what are your long-term goals and find programs that match that vision. Are you someone who wants to work in the community? Are you someone who wants to remain in academia? Someone who really wants research to be a part of their career? Or someone who really enjoys teaching and definitely knows they want to teach in the future? And there you have it. That is our medical school overview. If you want to learn more in depth and get expert guidance from admissions experts, medical students, and resident physicians, join us at Premed Academy, where we help pre-med students get into their dream med school through low-cost education. Check the link in the description to find out how to sign up today.